Are you guys mobilized? I mean stabilized?
Yeah. That's the one thing we learned we're not.
That's good.
Speak for
That's good to
myself.
learn.
Y'all are.
All right, so we're gonna see that stability and mobility go hand in hand. So we're gonna work on the mobility in here. We're gonna start with our ankles and work up to the rest of our spine. So what we found with tight ankles or decreased ankle mobility is that it affects our spine. So if you have stiff ankles, if you have pronation, if you have eversion, if you go step out the way, or if you have restriction in how you walk, it causes gait differences. It causes forces to be received differently in your spine, and then cause restriction, pain, and an avenue for injury to come into your spine. So the first mobility exercise we're going to do is the four-way ankle movement. So how many people have done that before? Flexion, extension. Okay, a lot of people have. But I mean, here's the thing. You can go through movements without being intentional and without increasing in your mobility. So what the key to this is to be very focused on these movements and to take your time with them. And over time, when you do that, you should see increased ranges of motions, improved gait, improved upper joint health and into the spine. Everything impacts the spine. It all works together. Our spine allows us to move. Without our spine, our other joints aren't able to move. So we're gonna start at the bottom first.
Some older people shuffle because their ankles.
That's part of it. So there's a lot of things that can go into that. The other part of that is decreased sensory perception with the position of their spine. So this decreases your sensory perception and how your body can tell where it is in the space it is. So people fall, older people fall because they can't tell what's around them. If I'm out here, I can't see the little dog coming towards my feet or the curb. Does that make sense? So sensory input. We have a lot of sensory nerves in every joint, and it's important to keep those joints healthy for that input. So I'm gonna show you, even if you've done this 1,000 times, this four-way joint mobility exercise, and then have you guys do it. So go ahead and sit down. I'm gonna sit here in the middle. If you can't see me, or if you need me to show you something twice, please let me know. So taking your time with these is key. I will turn around in a moment. So we're gonna do both legs. I'm gonna show you on one leg this exercise. So with this, you're gonna lay on your back. The leg you're not working is gonna be straight. The leg you're not working is gonna be straight. You're gonna put your leg at a 90-degree angle, and you can support it under the knee. Now, you're gonna go into flexion. So bring your toes towards your face. Really push to your end range of motion, so where you feel restriction, really push it there and hold it there and try to push beyond that. And then you're gonna go into toe pointing. Push into that as well. Really think about how your foot is moving, because you could do this all day, right? You could do this all day. It's not gonna hurt anything, it's not gonna do anything. But you really push into your restriction, your end range of motion, as much as you can, and you're gonna see increased flexibility. I'm getting a cramp on the arch of my foot, so that might be something you get. That's because I'm tight at my plantar. This is one where people tend to get lazy on, so very touchable. This is called inversion. So bring the bottom of your foot towards the middle of your body, like this, okay? You're not doing this. You're not just pointing your toes over. You're rotating at the ankle and bringing the bottom of your foot towards the middle of your body. Next, you're going to bring the bottom of your foot towards the outside of your body. You're not pointing your toes out. You're keeping your toes towards the ceiling as much as possible while rotating at the ankle to the side of your body. Did you guys see that?
Yeah.
This way? Any questions?
I have a question. I've had a total ankle fusion.
Okay,
So
so you might not be able to
I
get
have
very.
a little dorsiflexion, but this is from being in the water.
So
I cannot do anything.
completely fine.
It's like
That is,
Do what you can do.
yeah, you're gonna work with that, but that's totally understandable. You probably won't see improvement in that, but you're gonna keep the range of motion that you have by doing this. Does that make sense? It'll help you keep the range of motion
That's
that
why
you
I
have.
do the water toss.
Good. Yeah, questions?
How many reps?
Okay, so if we're ready to start, everybody get down. We're gonna do 10 reps on each leg. We're gonna start with our right leg, so everybody's on the same side. The leg you're not working, extend it out, straighten it out, unless it causes severe low back pain. 90-degree bend at that, so bring your foot down in the bend. Yes, yes. Excellent. All right, go into your deepest flexion. Bring that toe up. Yes. And then point your toes. Point, point, point. Ooh, is there a cramp?
It's cramping the bottom of my foot.
Okay. And then bring your foot back to neutral and turn the bottom of your foot towards the middle of your body. That looks good. That looks good. That looks good. Good, good. And then go to the outside of your body. There you go. Repeat that 9 more times. Just go through that. I'm gonna walk around. That's good. Good. Go the other way for me. Good. Yep. Yep. Yes. This one. Yep. Good. When you guys are ready to switch legs, you can. And I'll just keep coming around.
That's a good flex.
That's a good
Flex room. Awesome. Now to your point. Alright.
Does it, I can move it out, but I can't move it in.
And then your external should be your smallest amount.
Good. See, you're learning things about yourself.
Hey, I'm able to actually put my hand on the ground, it's a miracle in itself. That hurts still doing that. Actually, it's to be right here.
Yeah, hang there. We're good so far. You're gonna do your dance going right now.
Okay.
But if you're getting some pulling, I feel like
Yeah.
it's pull next. That's a good exercise for you. Then let that chin go as high as you can.
Yeah.
Awesome. It feels good? Yes.
Yeah. See my neck, I'm just watching my toe. How are you doing? Did you both feet? Go in, no problem.
Yeah.
We're gonna go out.
She's gonna show us my two sizes to be able to deepen how far you get into that. But yes, that external one's always gonna be the hardest.
That's really weird.
Part of that's also could be you're holding it like up in the air, so we're activating this as
Yeah.
well. So you might have some soreness there.
Bring it up to neutral. Bottom of your foot towards the middle. Has everybody gone through theirs? Any questions, comments?
Is there a difference between doing this laying back and sitting up?
Like in a chair?
Like if you were to sit like we're sitting right here.
It's, well, I mean, if you're sitting there and your foot's right, you have to bring your foot up.
So
But-
okay.
Or if you have a hard time on the floor, sit in a chair.
Just lift your leg straight out.
Yeah,
Oh, okay, hold it.
you can bend it.
I'm feeling
Gotcha.
here.
I put my ankle, I mean,
issues go back to the
my life has been, it's, sometimes feels like there's people that go ahead and put I just didn't know that I could feel, a little issue.
When you were doing it?
Yeah.
That's what these will bring to light, right?
Yes.
It's good to do, and it'll help straighten those areas with, yes, because that's a lot of injury if you rotated, sprained, or twisted your ankle. Okay. We're gonna move on to the slant board, so we can all stand up. The slant board's over here against the wall. Someone I will have to ask to move your stuff temporarily.
Off of the slant board.
Okay, so this is gonna show you another aspect of your ankle mobility. So again, with this, will help you shift your center of mass to where it's supposed to be with your ankle mobility, and it's gonna come all the way up. You're gonna feel it anywhere in your hips, your calves, your low back, maybe mid back, but your low back, hips, and calves are the main places you feel this at. Now, the point of standing in dorsiflexion is what it's called when you bring your foot up like this, is to bring more mobility in the ankle and to get your center of mass where it should be. I have a neighbor, her center of mass, women have it here, men have it here, and she constantly is like this. So if she stood on the slant board, she would be coming back forward like this, is one of the aspects. Now, the key to this slant board, this has different levels. So this is the lowest level. If you feel very comfortable on this and you're not feeling any tension in your calves or anything, go as high as you can. So it goes all the way up to here. That's very steep.
Oh,
But we're gonna start on the lowest one. Now what we need to do is, you're gonna stand on this, and you're gonna put your ankles against the wall. If you have oh, I'm sorry, heel. I'm thinking about ankle mobility.
Wait, I don't know if I can do that.
Your heel against the wall. If you have your socks on, your socks might stick to this, but you're gonna stand with your heel against the wall. And you're going to make sure your butt is against the wall, your back is against the wall, and your shoulders are against the wall. Usually, your shoulders aren't gonna touch the wall because of this. This is the space we have to do this in today. And as you stand here, you're going to relax your quad muscles, your thighs, your glutes or your butt muscles. It's very important to work on. So this is body connection. If you're ever standing in a position and it's very hard to get a muscle to relax that you need it to relax, there's a disconnect. And the way to think about that and to get that reconnected is to stand just like this in this instance. Close your eyes, and you're gonna stand on this, well not today, but when you do it here in the office or at home, 2 minutes, and you concentrate. Are my thighs relaxed? Are my calves relaxed? Are my glutes relaxed? And you're just gonna stand here and breathe for 2 minutes. And what you should notice is different parts of your body unlocking and just coming into ease. All the while working on ankle mobility. Does that make sense? Any questions about that at all? If you can't do it,
I probably can do that.
okay,
I'll give it a try.
okay, perfect. Now for me, my calves are very tight, so I'm feeling a stretch the whole time. And so, but the longer you do this, and the more you breathe into it, you're gonna feel those relax as well. So this is really good for ankle mobility and flexibility, okay? All right, who's the first 3 that wanna try it?
Okay.
Okay, you can be the next 3. Thank you, thank you.
Yeah, I don't think I can do this.
I was gonna say, stand a little further out then, if you need to. Because then you're getting some flexibility. Oh, look at that.
It's just a way to put on there.
Where do you feel tightness? Or do you? Okay. Okay.
A little bit of tightness in this calf. really don't miss them.
Okay.
I have one of these at home.
Okay.
Oh, that's
Go here.
I do this at home.
Beautiful.
Where'd you get your?
Where'd you get it?
Amazon.
Oh, yeah, these we got off of Amazon as well.
Yeah, Dr. Cameron told me probably 2 years ago.
What are they called?
Slant boards. Yeah.
Novel names.
Stabilize my knees, actually. Yeah. Yeah.
I think it'd be more work for me.
Well, when I go to the gym, yeah, I do. No. It wasn't. Because of that knee injury.
Look at what I can see. Center of mass difference, so it automatically gets you.
So I go and stand up with those three.
Ladies first, huh?
So as you get more flexible on the basic, you'll put up this. Next time you're in the office, try it.
My MRI showed. So they have to go down like this.
Stop right.
Some people will, some people won't, but yeah, it's your ankles.
If I'm feeling it, my low back. Okay, because no, I'm
They
sure.
should be, and then that's where breathing comes in to start unlocking that low back. Yeah. They're there on that one. They are. But you would either start further up here, not push this back there, or you start off of that, like this, these would then start dripping. So, I don't remember what exactly. What's it really to do? Because it's
No.
Yeah.
But
How many?
we can double check with them and see.
Or something like that. Yeah. Okay.
How long is
Yeah, a good little catchphrase.
I didn't have my, wasn't already.
it? They just did it, you're almost
That
done.
was a good one. I coined that for us.
I felt so.
You're in the motion.
What, you better text it back to them? Have you ever done that against the wall or something? You can do it without the slant board. So you can go up to your wall, do the reverse, start from those two days.
So basically, you should be able to notice over the next couple of days, it's just as fast. It's not just like you're gonna get how quickly your body adapts. So in like 2 weeks, you'll be like, I'm fine, you're free now. You know? So it'll be really exciting.
This one's more right. Hitting them. I'm not gonna be comfortable no matter what. My knees are not hands. Push myself down and get my head up this way. And this thing's lower my back. So I'm not gonna do it. My back hurts on this. But I can feel it in my everywhere I go.
So I have been sideways or this way, and then I stand this way with that external rotation. So
Oh, you could do that.
I didn't have those, so I've been working on these.
That'll
Like
work.
this.
That's a great.
Really against the wall too. I have been, but I think that would be more beneficial so that I'm not doing this number.
That's a good idea.
I'm falling like you're talking about. Standing this way is much harder. I don't have the balance to do that. So if I was against a wall,
You know that you do. It's the back order.
I mean, the price on Amazon is
yeah. You may have to have them a little bit away from the wall. It's not quite as long as that. But I do this. I do this at home all the time.
You do just don't need
I use these. Yeah. So if you ever want to play with these before buying something, these are smaller than that, so it'd be a good place to start.
Yeah.
And then you can work on those same rotations that you used before in a standing position. Now I've got the external going that way. You've got your internal going this way, or you've got that internal.
Oh, okay, that helps push it more.
Right. So then you can
And
practice.
pushing it myself doesn't. I'm going, I don't know how I'm gonna improve if that would work.
So those wedges you're talking about would be no different than using something like that. I wouldn't necessarily say you have to have that slant. Go ahead. They're less stable, but they do a job of a match.
So you said those come in home care.
Yeah, they came in home care kits.
I didn't get those. No, all right. I think I
Yeah.
You don't do the lay on. So you don't do the laying on your back with those shoved in?
Some people don't get that exercise, so we
That's not your exercise.
Yeah. Oh, yeah, yeah, okay. So you need to put that dollar. Yeah, we can definitely.
It's a flat wall. You can actually try it. That wall is not. Right.
Yeah.
Those kind of all over that's what the house. Are we still left?
Yeah, so you can spread your feet a little
Oh,
bit.
yeah.
And since you would have to sit close together.
Oh yeah.
Oh, yeah, no, no. Yeah. Well, you opened your entire chest cavity, your shoulders back. What we would do
Oh, that's awesome. Oh yeah.
and you got those blocks at home.
Right.
So you can get all your legs.
Right here too. That
Yes,
really helped me.
because of this motion that you did.
Yeah.
When you pulled your chest up and you lifted from
But
your.
the only time I find I do that 12-minute lower back workout, the one that you're having to do this. That's the one that everyone's actually takes the pain away.
Okay. Have you started doing any on your vibe over there? Have you started adding any of these?
Yeah, I do.
That's a good help in that area,
I'll
especially if that
do
motion
the
is helpful.
movement, and then I'll do the movement lower.
Yes, that's really awesome.
Do that as well. And I'm finding, actually, I can feel my toes. The toes are-
Right. Yes, that's kind of the thing.
The heels.
Yes.
And I My legs were not.
Alright, nice job, guys. So we're gonna move on because we're running out of time. Any questions about the slant board?
Oh, okay, yeah.
Okay, so we're 2 minutes at least, yeah.
This muscle that's tight across.
Alright, so we're gonna go into our hips. So 90-90s. Has everybody heard those terms too? And done them? So this is in hip mobility. So I'm gonna show you again how it's done. Now, I need to emphasize this is when we start, before you even go into your 90-90s, I want wide legs. People want, it's hard to move your hips when your legs are this close. So you're gonna start out with wide legs, wide knees, straight back as much as possible. And then from here, you can put your hands here to stabilize you, here, if you want, on your knees, whatever is most comfortable. You're gonna go directly into a 90-degree on both legs. So, wide knees, 90 degrees, okay? And then you're gonna go back to wide knees, 90 degrees. And this is the movement, 90 degrees, okay? This puts mobility into the hips. I am more restricted, I think on my right.
Yeah.
One of them is more restricted. But the more you do this, you can feel it in your low back stretching out. And you're gonna feel it. Sometimes you'll walk forward as you're doing it, that's fine. Just reset yourself. Important to have wide knees and just go directly into 90 degrees, okay?
So can you balance yourself this
Yes.
way?
Yes.
Yeah, like that. You balance yourself. Yep, that's it.
As if you have to balance yourself and your back's back here, as you do these, work on straightening and coming up as much as you can. Now, if you have limitations, that's understandable, but as you get stronger, more mobility, work on getting that back straight. So do 8 on each side, 16 total. And I'm gonna walk around if anybody has questions, but start. You do. You can put them here or back behind here to stabilize you. I like to reset myself, make sure my form is good, so yes, stop there in the middle there.
You might want to scoot over.
Yeah.
You're gonna hit that wall.
Used to get on Smith Force.
Good job.
Our next was just do that.
Sorry.
Well, that's okay.
There you go.
Drop this down. As much as possible. If you need to lean back because you're restricted, that's something else. Can you drop this leg lower? Drop it. There. There you go. So you really want to think about your movement. You don't want to just fly through because we miss our form just like that.
Well, that's the cool thing about this is once you notice where your
That will come with more flexibility. If it does touch the ground, great.
I thought it was you play into
No, whoa, said something.
where your wheels is. You can just sit up and start working on that motion.
Good.
Make your ankle outside.
Awesome. Can you drop me one side? Awesome.
To make
If
it.
you're not able to get that foot in from here,
More
try
rotation.
moving that ankle.
Because if you hold it up, then obviously it's more flexibility to that joint. Is that what you're asking? Yeah.
Yeah, I feel the same. I feel the same.
You have good. I'm gonna show you a progression.
It's because of.
Oh, perfect. That's great. That looks good. That looks good. Well, that's so loud. Yes. Yeah, and if you can, bring your feet closer to you when you first start out, bring your feet in. Got it. I know. It's like, oh, yes, yes. Okay, and if you can't do that, so I'm gonna oh, beautiful. That's good.
Yep, and then do that, and just hips comes in, back down. Yeah, there you go. Beautiful.
questions about that?
Yes, I understand.
And how many did you say, 8 on each side?
Yeah, did everybody get through them?
I get one, I'm done here.
I'm glad you're here.
You're down there and you're here,
Progression. Once you get that first part down where you feel like you're moving fluidly through and you're being intentional, the progression is this and then this. Okay? You bring your hip forward. So this is where I was. Bring your hip forward. You're gonna feel it in the front more. I can feel it back here as well. Okay? Once you get that down, you can lean forward. And that brings more mobility in that bottom hip. Not everybody has to try this if they don't want to. Well, that could. If it's acutely herniated, if it's healed, it should. Yeah. If you herniated it yesterday, don't.
But if it's been like that,
Yeah, if it's healed, this is fine. Actually, this is good. Yeah. And then the last progression before we move on is
okay, there's always more.
you extend the back leg. So it's pigeon. Who's done pigeon?
Oh, yeah.
Oh, this is
I don't even want to try it. I'm not
Okay.
Yeah.
So these are progressions that you can make as goals. As goals. I mean, you're doing a pretty good job right there. That's good. That's a good start. All right. Any questions about that? Hip mobility is huge for your low back. Huge. So I'm constantly restricted on one side. It's annoying, but I'm constantly working on it, and I've definitely felt better doing this stuff in the morning if you can. If you have a routine, fit it in there. You're going to feel a big difference in how your spine's just going to feel warm and more fluid. Okay. All right. Any questions before we move on? Okay. Another stretch that I give to almost all my patients is the cat-cow or cat-camel, I think some people call it.
Oh, yeah, he did, told us not to do that, didn't he?
He wouldn't do that to
He
me.
said, she'll, oh, yeah, do that.
Now, you can do this all day, right? Sorry, guys. But so this, just like every other movement, has to be done with focus and attention, taking your time and breathing through it. That's how your body responds, and it has time to respond and do what it needs to do. So again, I'm gonna show you, and then I want you to do about 8 of them, 5 days if you can. So I constantly have my butt towards you guys, so I'm sorry. I will turn around. You're gonna be in a quadruped position, so knees under the hips, arms under the shoulders. Okay, very stabilized. You don't wanna sink down into your shoulders. You wanna push off the floor and stabilize here. Now, when you start this movement, it's always started here. It's always started here. You go into cat. You're gonna curl, starting at your low back. Curl under. Allow your spine to follow through as you punch or curl your upper back as much as you can. Allow your head to drop. You don't need to tuck it. You just let it drop and hang. And then start at the low back and arch. Your head coming up last into neutral. You don't need to exaggerate your head. Just bring it up to neutral. And exhale. As we say, if we inhale, we're going to cat. Yeah. Slow, methodical. Allow yourself to feel your movement through that. And again, don't sag into your shoulders, okay? So, quadruped position. Again, start in the low back. Inhale. Let your head hang. Push off the floor into that punch or roll back. And then
move through your low back up into your shoulders. And exhale. Head in neutral position.
Just let your head drop. Extend the toes if you can.
Yeah, on the face.
Okay.
Get on the face when I can, this.
And then breathe. And exhale and start rolling through your spine and bring it this way. Good. Let it roll through, bring your head up to neutral. Try it. Yes. That looks good. That looks good. Try to start down here. Mind-body connection. So go down again. Punch this, roll this up, nope, the other way. Okay, now, as you go the other direction, start here. Yes, that's great. Try to keep your hips over your knees. You started over your knees and then you move forward. So that's, yep. And then start here and drop. Yes, you are in the right position to start. There. Now start here. Yes. How you doing, Chris? No, you're good, you're good. Keep going through the movement.
Yeah,
Good.
I have an artificial knee and it does not feel good.
This is what we use for these.
Oh.
Super good shape right here.
There you go. Exaggerated, yep.
Oh, much better.
Much comfier?
Much, yes.
Good, beautiful.
Thanks.
Good, good.
Head to neutral. Awesome.
Yeah, so like it's pulling on it? Yeah. That wouldn't be a bad position, that was good, like to have it as bent over and open, so you can oil, yes, yeah. Awesome.
Start the other way here. Relax. Everybody feel like they got that? Okay. Who said name? Do you have any questions? That looks good. Just make sure you start here and let your head up last. So start here, bring this up, curl, curl, curl. Keep your head down, let your head relax, curl your backs. Yes. Push through here. Now start here, let it curl down, bring your head, let your head. Okay. That looks pretty good. The only thing that I see a couple people doing is rocking back when they're coming up. So you're in the cat, and then when you come down here, you want to rock back.
Oh, yeah.
Try to stay on all fours, just like this. And like this. So you don't want to rock back into your sitting position. You want me to help you walk you through it?
I was just making sure I was doing it.
Yeah. Let your head relax, and then start here, curling it. Good. Neutral position. Awesome. Oh, I saw everybody's doing really good. All right. Did you put the weight of the whiteboard? It's right here. Oh, okay.
That's right there.
How much time do I
I need
have?
more space.
All right, I really want to show you something, and then we're going to do our last exercise, and that is the Mackenzie stretch. So it's important to have an understanding of our discs and how they function. Mackenzie was made by a doctor specifically for disc issues and bulging discs, ruptured discs, all the disc things that so many people experience. So it's to have a good understanding of injury and discs is this. I'm gonna draw a disc here the best I can. I'm a terrible artist, so please forgive me. This is looking down straight through the body, this way. This is a disc from the side view. Okay, so our disc is very well made, our body is. Intelligent design. In the middle of the discs, right here, is the very center of our disc. It's called the nucleus pulposus. It's a gelatinous center. It's jelly-like right here, okay? It's what allows for axial forces for loads, okay? These rings are annulus fibers, and they're so well made that each ring goes in an opposite direction as the fibers to allow for a lot of strength in those rings, okay? Now, what happens when we throw our back out or injure our disc or have a bulging disc is these annulus fibers, it starts out as young as a football injury in our low back, okay? Let's call it a football injury. And it was a minor tweak to my back, and it was okay within a couple days back out on the field. What happens typically, and this isn't all the time, this is pertaining to discs. I just think it's very important to understand the function of our discs and how it works. Is there's a ton of layers. This is the middle, and then we have our spinal canal out in the back, and then in the front is a big ligament. It's very, very strong, and then our guts. So injury to a layer. Injury. I was okay in 2 days. Body laid down scar tissue. This area is weak now, okay? It's recovered, it's healed in a sense that it's got scar tissue laid down, but it's still been injured, okay? We'll go up through life doing rotations, laying down construction, teaching and standing all day, sitting all day, whatever it may be, and it weakens the areas of the back. Well, if we have more micro injuries is what I'm gonna call it. Now we can have a trauma, a huge trauma that will rupture straight through, right? This is talking about most people's everyday life is there's more damage. And as there's more damage, the nucleus pulposus is heading out, okay? Until one day there's so much damage that it opens an area, the nucleus comes out, and that is a ruptured disc. There's different stages for that, okay? So there's one where it gets into the fibers, there's one where it gets outside of the fibers and disconnects. The body will eventually break that down and reabsorb it, but it causes a lot of pain in the meantime. But this is from the side, and it comes out this way. Now, that's gonna be the back. Our discs tend to rupture towards the back because that is the pathway of least resistance. We have huge ligaments that align the spine. It's very hard to get past them. It runs down the whole spine. So that's what I really want people to understand is how this works. You don't just tweak your back and it's all better. There is scar tissue, there is injury there, okay? That's how it ends up being that we're 40 or 60 with a very weak back and a lot of injury leading to a bulging disc or whatnot. Any questions about that at all? Okay, so this Mackenzie stretch, it is like Cobra, okay? It's to help with pain that is not staying central, it is going down our legs. That's what it was intended for. It's very good for mobility. It's not something you have to do every day for like a stretch. Like preventative, but it doesn't hurt because, you know, we do Cobra and yoga, or do you do it in Pilates? Do stuff like that?
Some of it.
Okay. So, say you're very acute, someone just tweaked their back, they would do nothing else but lay prone on their stomach with their head to the side. Now this is serious, like when Moses' backs went out and he would have to lay here until he felt like he could move without it spasming. Okay, the reason why you don't stretch into an injured area is because it's the body's way of protecting itself. So if you stretch into tight muscle, it doesn't help. It's a protective. Okay. Now, if you're not and you have history of disc issues or you're healing from one, what you want to do is put your hands under your shoulders, and you're going to push up in a cobra position as high as you can go. So if you can go here, that's okay. If you can go here, that's okay. If you can go here, that is okay. You don't want to keep tense in any position. So in any position that you can go up, and body-mind connection. Your butt muscles need to relax, your thighs need to relax, and the only muscles that are being used are right here to push yourself up. And you breathe and allow, you'll feel your low back drop towards the mat. If you stay tense, like if you tense up your butt muscles and all that, it's counterproductive. It's not allowing that low back to decompress. And then you hold that for 2 breaths, and then come down for 2 breaths, and come back up for 2 breaths. When you're up here, is my glutes relaxed? Is my low back relaxed? Or is my thighs relaxed? And allow yourself to breathe into that, okay? All right, so let me show you over here where your hand position is. You don't want your hands out here. You want them under your shoulders. Start with your forearms on the mat if you can, and push off. Now again, you can do this all day. Make sure that every muscle is relaxed after you go up. If that's it, that's good. That's good. You don't have to
do it
be.
like this?
Yes. You don't have to fold yourself in half. You don't have to be the most limber person in the room. It's what's good for your body is you know your limit and you're pushing into that. The key again is to make sure you're relaxed. Once you're up there, it's hard at first. It was for me, especially my glutes, just because it's natural to tighten those up when you're in this position.
So you said not to do this every day?
I mean, it's not one that is really, it's not something you have to do for prevention. It's to help with disc issues, but it doesn't hurt to do them because it's definitely getting more flexibility and mobility in that low back, especially if you can relax. Is anybody having a hard time? Any questions?
Even just like this? Probably more so than straight arms.
Doesn't hurt when you're just going flat down.
So more to.
Stay there until it hurts less. Or it starts to feel good laying there, and then you can start moving up. Because you're inflamed right now.
On those injections. Several years.
Push up, Chris. Relax those butt muscles.
That's the hard part.
I know. Keep working on it. Because the more you think about it as you're doing it, the more connection you have.
When I was diagnosed with concussions, complex regional pain syndrome,
So is this hard?
called RSD.
That's as far as I go.
Yes. Yes. You mind? Really, what you'll feel is typically tightness right here. And then as you relax into it, it starts to drop down. And you're relaxing into it. So this is relaxed. These are relaxed. Does this feel comfortable?
I just went to things like
So you do this, you breathe into it, and then just let the relaxation
I'm open.
So the first block they did, I was like, oh my gosh, thinking,
That's good too, because that's stretching.
no, a permanent thing. I felt like I did before depression, right? And so,
Okay, that looks good. You guys doing good?
so I do exercise, I signed
Okay.
up. I wanted out of that pain. And the pain medications.
I got one leg.
Medications are not the answer.
Okay, so yeah, I don't know what I'm doing. It keeps tensing my butt. Don't
So
tense your
finishing
butt.
up over there. So this is what we've done here for mobility. Any questions about anything? You're welcome. Okay.
So what's the tall kneeling Pella press?
He covered that. I was going to, we switched to last minute after I got these printed, but
That was those things.
That's that, okay.
yeah.
What do you call it? Anti-rotational or something?
It's also, yes,
Okay.
it's
So
also
very
that.
good, okay.
Yes.
Then never mind.
Sorry about that, guys.
I was like, I'm missing
I
one.
don't know if you do this out because I keep tensing my butt.
Yeah.
I use my arms, all I feel is my arms.
When is this gonna
Come
happen?
up just as far as you can,
I'm like,
and then work on relaxing those legs. It's work, so. There you go. Yep, and then that's natural to reflex.
the more you do it, the more you can start.
There you go. Good.
So I feel it right in here,
Yes, you're going to.
but I feel it in my neck.
Well, you're going to feel it there too. So it's not open or anything.
Good work, guys. Back feels stronger.
Well, and they've changed the container twice now, so some.
All right, guys, we're gonna everybody come in. We're gonna wrap up with some prevention
Yeah, just bring it back to us. We'll
and some best practices.
Thank you. You're welcome.
If you borrowed a mat, just hold on to it for a sec, and then we'll return it at the end. Show of hands, who learned or did something today that they'd never done before? That's all that matters. If you learned one thing or picked up one thing you hadn't done before, that's a win for today. So before we get into the prevention, what we covered, you could do every day. If I were in back pain, I would do this every day. Me personally, I would do this routine every day until I was out of pain. If you're in pain, your body will prioritize protecting your nervous system. It will send pain to you if it has instability or a lack of flexibility. Your body is going to tell you because your spinal cord is housed by your spine. Is everybody with me? So if you have pain, don't sleep on this. You can do it 3 times a week. You can do that recommendation. Why mess with it? Do it every day if you have pain. Every single day, do it once through. You guys have all the tools. You should leave with a sheet. You guys know your rep counts. Is everybody with me? Know the reps? Awesome.
All right. So again, thanks for being here. I'm glad you guys all came. So with prevention, who's not under chiropractic care in here? I knew that. That's great. So alignment is the #1 recommended, most researched. Chiropractic is the best for low back pain specifically. It's one of the most researched areas of the body for chiropractic. And Harvard Medical School recommends spinal manipulation for low back pain because they think it's mostly musculoskeletal. Sometimes they're not sure what causes it. And so that's why this place is so great, because we are determined to get to the root cause of your pain. Specifically today we're talking about low back pain. And the reason why they're not sure is because when they look at images, they're looking for significant change, a broken back, a ruptured disc. But if you have low back pain, you don't have that, then chiropractic is the best thing for you, okay? And then who still does their home care? I should see every single hand up. Okay? Every single hand. Because home care is not just during your initial intensive or corrective care. It is to do your whole life through. So what we've gone over today, home care keeps the spine moving when you're not here. It keeps that mobility into your spine when you're not here. That's why it's important to continue that. after you've been here for, I mean, a lot of you have been here a really long time, which is awesome. Like, we love to see that, but continuing that, and the reason why you're here today is because you want to know. So implementing this stuff, mobility, stability into that home care that you do or do not do, start it back up and bring this into it. It keeps your spine moving. The spine is, to me, is really the bread of life of movement and quality of life to do what you want to do, that you should be able to do as you age. What else am I supposed- Oh, I want to show you a proper sitting position that I often go through. I don't want to sit on this mat here.
That's what
If someone sits at a desk for a long time or a lot throughout the day, even for me watching a movie, it's very important to have a proper sitting position. So when you're sitting in a chair, we talked about the wide leg stance with the 90-90s. It's best to separate the knees. And so a lot of my ladies, when I say that, they're like this. I'm like, you really gotta separate the knees, okay? I know we're not, I know it's not ladylike.
What are we in
Yeah.
Jamaica or what's
Separate them. This puts your pelvis in a nice neutral position, and your spine will pretty much follow that. But if you're sitting in a chair and wide knees, your pelvis comes forward. And then what you can do is go into the exaggerated proper posture and then bring it back 30%. That's a really good position to sit in if you're gonna be sitting for a long time, okay? Another thing that you can do if you're sitting in a chair for a long time or at a desk job and you're having low back pain and you're not able to get up and walk around, or you just need some relief and some help, you're gonna get lumbar support, a cushion or rolled up towel. This is just to help when your back is going through change and it's weak at the time as you're working on it to get stronger. Sit with wide knees all the way to the back of the chair. This chair is a little tall for me, I'm short. Take the support and then put it in, okay? Don't put the support in and sit into it. Sit with your butt, back of the chair, proper position. Put the support in your car, in the chair that you're using, wherever you're sitting a long time, and then put that in. And that's gonna help support your low back when it's in its weaker seasons, yes.
Is there any benefit when you're sitting in a car driving along the way to put something underneath your butt?
Yeah, so a lot of like this one, a lot of chairs and cars, they kind of slope.
Yeah.
Yes, even that out.
For roll?
Yeah,
You
fold up.
don't want it taking your pelvis back, like you see it, you know how the chairs kind of sit back in your cars?
Yeah.
You don't want anything to allow for your lumbar spine to straighten. You want to do everything to have more curve in your pelvis and more curve in your low back.
So that's why the
Yeah.
roll under your butt helps.
If it tilts your pelvis forward.
Yeah, okay.
Okay.
All right, any questions about sitting positions? Awesome.
Okay.
So don't sit on the
That's it.
couch is what you're saying.
Huh?
Yeah.
Don't sit on the couch.
You're gonna sit like, I mean, my kids make fun of me, you know, that's how you wanna avoid this at all costs. Now you're under a load with no curve. Does anybody have a phone I can use real quick? I've gotta just make a mention of this. When we catch you out here
Yes.
sitting like this, no pointing fingers, but what is happening is you are serving your phone. In this position, your phone is serving you. Don't go into a body language where your life surrounds around this, and we see it with kids, you get sucked into this. You're serving this phone. In this position, this is the tool, right? I'm the person, this should be serving me in this way. So I'm not perfect, like I'm not saying perfect, but we catch you guys not you guys. You guys are here on a Saturday at a workshop, not you guys. But we do catch people and then my number's up, and they come in and get adjusted from that position. So thank you. Your phone serves you, not the other way around. We're gonna talk about lifting. You guys, everybody went to my side. Remember the big three and the pull-off press. What do we do before we engage in those exercises for spinal stability? That's what we're gonna do before you lift anything that's over 15 pounds. So I've now given myself a weight belt by using the oxygen. I'm increasing what's called interabdominal pressure, okay? What you're protecting when you lift at all costs, and we talked about it with the glute weakness, is we want to hinge at the hips and keep that curve. Do you guys see me not hinging at the hips here? So even if I lift and hold, I can feel that in my low back. I want to get that neutral spine position. That's how I'm going to lift something. And I'm using my butt muscles. Is everybody with me?
I was always told to bend my knees more to go to it.
So say something's really
So I
low.
don't do that, yeah.
So that's where it gets difficult. So I got to pick this up.
Yeah, that little-
How I would pick this up is hinging. See, I'm not bending down here like this. It's okay, but what I find with this is then what can happen to my low back as I lift it. What takes primary is I'm going to keep a curve in my back through lifting. What's not allowed is this. Okay? So I'm gonna lift something. If I'm gonna do something stupid, like lift something really heavy, that's the only time I recommend like a weight belt. You know what I mean? Like I'm not a big proponent of weight belts or back braces for like people that wear them all the time. It weakens the core, but if you're gonna do something stupid, wear a back brace and then take it off. Yes,
What if it's too heavy to lift and you just want to drag it?
that's fine.
Same
Same.
thing?
Keep the curve in your low back, but don't drag it like that. So that's what's key with lifting is inner abdominal pressure, curve in your low back. Everybody with me? Sleeping. Who can tell me the best sleep position? Got it.
With the rolls.
With the rolls if possible. Now this is, a lot of people don't, and I didn't really know this till it was explained to me properly. It's very hard to heal ligament damage in anywhere in the body, but especially the spine. And the only way that you heal ligament damage is you shorten the tissue for a long amount of time. So how are we accomplishing the shortening in the neck and the curves in the low back is you shorten that tissue when you lay over those rolls. So if you can sleep on, like, it's tough. I understand it can be difficult and uncomfortable, but say you lay on those for 6 hours, you have 6 hours of shortening those ligaments, and that's the only thing that allows ligaments to heal, is for them to be in a shortened position for a prolonged period of time. So what's best is on your back with rolls. I'm to the point now when you get a really healthy back, you can lay on your back with like a small pillow with no rolls and have no pain. It's very comfortable. That's really the goal. Side sleeping is second best if you want to use a body, some type of pillow so your shoulders and your hips don't collapse.
How do you use the body pillow?
Like right between your arms and then between your legs.
You're hugging it. Up underneath your arm?
I'm sorry?
In front.
Yeah, just right in front of you in your chest. You want to keep from, first of all, we're just not on our shoulder. We're on our back. But if we are, just again, I want to be very clear, like, you got to sleep.
Right.
Like, sleep whatever position's comfortable. Like, you need to sleep is more important than the position you sleep in. Do not sleep on your stomach if at all possible. It's not natural, it's not normal. There's a lot of studies that come out that show it causes ligament damage to sleep on your stomach because you got to have your head turned to the side. Okay? The mattress we recommend is medium firm. We recommend a BioPosture mattress. If you order one and let them know where your doctor, I can write you a letter so they make it with no flame retardants and it'll be chemical free. Like all mattresses, unless you have a doctor's note, are going to come with flame retardants from people that used to smoke when they went to sleep. And they're very hard chemicals. Flame retardants are harsh chemicals. They're endocrine disruptors. So BioPosture is what we recommend because it's the right firmness and it doesn't have chemicals if you get a doctor's note. Last thing, there are going to be cases in here. There's going to be people in here that you do everything right, but you've damaged your spine to a point. It's just really hard. There's what's called limitations in matter. You've damaged a disc, you have arthritis. Doing natural things is going to get you to a point, but you may plateau. And typically these people know it, like they've had some type of major injury or they have some type of condition or they've had low back pain for a really long time. What we recommend in that case, and I've mentioned it to a couple people, is there's nothing better than shockwave treatment. That is not, it's not a medication, there's no side effects to it, it's not a cortisone injection, it's a concentrated sound wave that goes into the tissue and remodels it. It makes new stem cells, it makes collagen. It is, the results we have seen have been over 98% positive. We've maybe had 2 people that didn't respond out of everybody. It's been unbelievable. It's been the best piece of medical equipment I've seen. If you want to take advantage of that, just tell the team. Hannah is who does it. You do what's called a discovery visit. They'll come in and map the area. So they'll like, does this hurt? Does this hurt? Spoiler alert, we're looking for where it hurts. And then what's so cool, what I love about this technology is you will know that day if it works for you. You will go, I feel better instantly. You will know immediately. That's how cool the technology it is. It's amazing stuff. They use it every Olympian. You guys watch the Olympics? They have it at the Olympics. It is the most powerful non-surgery, non-medical intervention for musculoskeletal system. It's excellent. So if you want to take advantage of that, talk to Hannah. Last thing I want to close with, guys, is I shared this with my team. Like, low back pain doesn't get me like fired up. I like changing people's lives, having them make better health choices so they avoid medications and surgery. I saw my family was destroyed from medications and surgery. I'm not saying there's never a time for them, but my grandparents overused them. My grandmother died from a back surgery. She got an infection getting a spinal stenosis surgery. This is a topic that is close to my heart. I just want to say that when you have chronic pain, they now know this, like especially low back pain, it affects you emotionally more than any other type of pain. They've now charted it that it affects your life more negatively than if you were to have arm pain or knee pain or foot pain. As if you get healthier and you go through these processes, and I just teach other people what you've learned. Tell them what you know. Tell them these things. If you have friends who knows somebody with low back pain, guys, teach them this stuff. Like, hey, I learned this. I've got the sheet. I'll share you with it. You guys did such a good job. You could tell other people what to do with these things. You may just think it's not just about low back pain. This is about quality of life. If you have terrible low back pain, do you want to exercise? No. You don't want to do anything. I don't want to eat good. I want to eat the bad food. My emotions aren't as good. I can't, like, everything is worse. So we want better outcomes. We want to help this community without drugs, without surgeries. Remember, there's no solutions. There's no cures. There's only what? Trade-offs. So when you take a med, when you have a surgery, again, I'm not saying there's a time and a place, but there is a trade-off there. And we want to choose natural trade-offs if we can, if at all possible. You guys are a great group. Everybody give yourself a hand. Good work today. Don't steal our mats.